Hello everyone, I'm Dr. Lintu Sam. I'm a specialist family medicine. I'm working in NMC Medical Center, Maysaloon, Sharjah. My areas of expertise are I am managing presently the acute and the chronic medical condition both in adults and in children. I specialize in preventive health care, patient education and treating the health style diseases as well. So today we'll be discussing about the importance of preventive health care and the aspect it has in today's day-to-day life. Before I talk about what is preventive medicine, let me ask you, what do we wish our friends and colleagues for New Year? We wish our friends to be happy, to have a prosperous. We also wish them to have a healthy year ahead. This is where preventive health or preventive medicine comes into play. This is an important aspect of modern medicine. It contributes to your overall health. Like what things we do to maintain a healthy lifestyle. The whole importance is like it will reduce your diseases, reduce your comorbidities and eventually death. Components of preventive medicine is we have primary prevention is there, we have a secondary prevention is there, we also have a tertiary prevention. Primary prevention is those techniques or the implements that we put in before actually a disease is there or before the disease is even started. So in that we have general ones like eating healthy, exercising regularly, your water consumption, your reducing your tobacco. All of them comes into play before the disease is actually set in. Okay, in that itself we have our vaccination. We have vaccination against communicable diseases that can actually be taken by everybody. And then we have our secondary prevention. Secondary prevention is where the things that we implement when there is actually the risk factors involved. In that we have our general checkup, we have our screening test. There are specific screening tests that people can take, and that it depends from person to person. So we'll talk more about this screening test. And then the tertiary prevention is when that is to reduce the disability. So that would involve physiotherapy after the disease has actually occurred. There is two ways we can look at it, who all needs screening. There are people who must require the screening and the people who can take it. So when we talk about people who can take screening, in my opinion, everybody should actually undergo a screening or an examination. This is especially for people who are like above 40 years of age. Once in a year they walk into a doctor and they the doctor, you can speak with the doctor, you can discuss about your conditions and the doctor will prescribe. So in that screening, it usually will be a physical examination, blood test will be there, and it will be tailored according to the patient's history and the physical examination. The patients who must require screening is suppose if there is any family history of any malignancy, like especially for females, like mother's maternal side history of any CA breast or CA ovary, CA uterus. All those patients, they actually need more specialized focus, like every year they need to undergo annual screening examination. Or in other cases, suppose if there is somebody who's got a very strong family history of heart issues, so they will require more screening or they will require more special attention rather than the general population. In my practice, a lot of patients come to me and ask, doctor, is there any way we can detect cancer? So the answer is yeah, we have ways to detect cancer even before it actually arises. But one thing we must understand is, like in our body, like different organs have different tumor markers. Like different tumor markers are also there, and different screening test is also there. Like as example, that is again divided for males and females. Males and all, we have our most of the ones, like if you're above 50 years, you can opt for a serum PSA, that is for the detection of prostate cancer. Then we have alpha fetoprotein, CEA, CA19.9. These are various tumor markers. There are for certain organs, they are certain organ specific. And then we are also for elementary, we are CA72.4. And especially in the case of females, then we have for ovary CA125 is there. For breast cancer also we have a tumor marker. Then we also have the general tumor markers as well. And in females, we usually emphasize, like if we're above 40, we have to undergo a mammogram. Yearly mammogram is what is advised, or according to your mammogram reports, we advise a screening. Then we also ask for ultrasound pelvis for the endometrial thickness, especially if there is any family history. It's always better that we screen ourselves to know, like, if there is anything with us. We are living in a fast-paced life, like especially in the Gulf country. We don't know actually what is happening. We are in a rat race. So sometimes, you might be having this headache. You might be ignoring it. You might think that, okay, it might be because of this tension. But we don't know, like, whether it's because of the tension or if it's because, you're developing a hypertension. So it is always better, like, just to come to have a general checkup, because there are sometimes, we might overlook it. Might be a rash. It must be, might be some rash, some fatigue, some things. They can all in some cases may implant something is going on underneath. So it is always better to come into the doctor, have a word with them. Annual health examination is always in this age, I would advise, it is important. The take-home message is we are stepping into a new year. We hope, or we wish that everybody looks into this new one in a different aspect. Like, it doesn't mean that you have to, like, be scared, but then we have everything, everyday things that we do which will have small contributions to it. Like, especially your health habits. In your health habits, like, make it to have a well-balanced diet, to reduce your calories, to reduce the saturated fatty acids, your water intake. All those are small things that will actually go a long way. And let me tell you the importance of exercise. Everybody needs to exercise at least 150 minutes per week. For if any other comorbid conditions aren't all out there, this are actually, this becomes your cornerstone of your therapy. So I hope, like, everybody visit your doctor, talk to them, even if the doctor doesn't say, say that, I have a family history. You say, doctor, can you suggest, like, what things I should do? How can I prevent it? Like, if you have diabetes or hypertension, doctor, can you talk to me, or can we discuss, what are the food I can take? Like, it will actually be helpful for you. It will help tailor your, you will have more impact of your medications on your health. Then everything will come together and you will become more healthy. Dear viewers, thank you for listening to me, and I hope at least some will take home this message that I have imparted to you. If you would like to know more about it and the importance of it, you can always visit me in NMC Medical Center, Maysaloon, Sharjah. Thank you.